Hi everyone, it's Tony McDonald here. I'm the Trust Executive Director for Integrated Care, Partnerships and Resilience, and I'm covering for Jawad in his Dr. Jawad update whilst he takes a well-earned break this week. So firstly, I'm going to start with the Islamic holy month of Ramadan, and indeed we've entered the last week of Ramadan. So thanks to all staff who have been working during this time. As previously mentioned, there is guidance on our SharePoint for both staff and managers if they need to use it for this final week. The conclusion of Ramadan will then be followed by Muslim colleagues celebrating Eid. So an early Eid Mubarak to those colleagues, and a big thank you to all our colleagues who will be working during this time. A few weeks ago, Dr. Jawad did a piece on Why Not Home, Why Not Today to support Easter and to enable patients to be discharged and transferred safely home or to their usual place of residence for the Easter holidays. So we're looking to see if we can do the same here and tie in Why Not Home, Why Not Today for patients who could be discharged safely home in time for Eid and also for the upcoming bank holiday weekend. As I've said before, Why Not Home, Why Not Today is our campaign to support patients who are safe to be discharged to return home. But it is a collective endeavour on the part of all colleagues within our organisation and indeed our wider system. So please play your part, and if there are patients who are safe to be discharged in time for Eid or for the bank holiday weekend, please do so. My second update relates to visiting restriction changes and particularly our maternity services visiting policy, which was updated on the 21st of April. One additional visitor can now visit the antenatal and postnatal wards on our Burnley General Teaching Hospital between the hours of 1 p.m. to 2 p.m. or between 5:30 and 6:30 p.m. The additional visitor can be one other adult who must be the same visitor for the duration of the visit. The additional visitor could also be a sibling of the newborn baby. From the 20th of April 2022, Rochdale Birth Centre also reopened to births. Just a reminder though that mask wearing, social distancing, hand hygiene, etc. still apply whilst in our hospitals and other healthcare settings. And please do comply with this. These arrangements are there to protect you, your loved ones, our staff and other visitors. For further information in relation to visiting at the Trust, please go on to the Trust website where you can find all the information you require. Okay, moving on then. My next update is around the bank holiday weekend that's coming up, so the 1st May bank holiday. And just a reminder that some local pharmacies will vary their usual opening hours during the long bank holiday weekend. So ensure that you have all the medication that you require during this time. You can also order repeat prescriptions via the NHS app. There are GP appointments available, including out of hours, over the bank holiday weekend. And we would encourage patients and indeed our communities to dial 111 for advice or non-emergency care should that be required. My final update is that it continues to be Stress Awareness Month at the moment. And of course, looking after ourselves both in terms of our mental health as well as our physical health and well-being is really, really important. We have in the Trust an array of health and well-being offers, including those for mental health well-being. And we know that every mind matters. And looking after your mind as well as your physical health is as important to your overall health and well-being. Okay, so that concludes the Dr. Jawad update from myself this week. Thank you for watching or listening. Take care, stay safe. For those celebrating Eid Mubarak, have a lovely time, and Dr. Jawad will be back to see you next time. Thanks, everyone.